Hi everyone, welcome back to my channel. My name is Jeffrey. Today we're going to go over some clinical markers, in particular in the heart, liver, and pancreas. Okay, so let's dive right in. The first thing we're going to talk about is myocardial infarction. This is essentially a condition where you have less blood flow to your heart, resulting in what you know as a heart attack. Okay, so there's going to be three major enzymes that we're going to look at here, or three major proteins that we're going to look at here, and then a side one as well. Okay, so we're going to start with CKMB or CK2. This is going to be creatine kinase. There's also a CK1 and a CK3. CK1 is for your brain, and CK3 is majority in your muscle, right? So CKMB or CK2 is majority expressed in your heart. So if this is going to be out in the plasma, then you can safely assume that that's a marker for a heart attack because those heart cells are dying, right? Troponin is a protein. It's a protein that's made in many different cells, but in particular, we're going to look at these markers that are specific in cardiac muscle. That's why I underline these C's. So these are TNT and TNI are only going to be expressed in your heart. That's why we test for those if we suspect that there's going to be a heart attack, because as your heart dies, obviously it's going to release its contents out into the serum. Okay, so for this it's cardiac, and then T is going to be your troponin, and then you can remember the rest with IT if that helps you remember any of that. Okay, so typically we test these two together. Lactate dehydrogenase is another enzyme. So essentially your LDH1 is going to be expressed in your heart, as well as LDH2, okay? And what we're going to look at is we're going to look at the difference of those in the serum in the blood, because your heart actually expresses much more LDH1 than LDH2. So if you have a lot of LDH1 in the serum as composed to LDH2, then you can safely assume that this person probably had a heart attack. Myoglobin markers, now these are relatively new, so they might not be as reliable as these three other proven methods for testing for a heart attack. Okay, so if we're going to just take a look here at a graph per se of what you would expect. On the bottom, on the x-axis, we're going to have time. It's going to be time in days, okay? So time in days on the bottom, and then on the y-axis, this is going to be your baseline measurements, so your normal measurements, and anything above that is going to be increased levels of this in the serum, okay? So if we're going to look at CKMB, this typically peaks at about a day. So if I'm going to redraw that, peaks about a day, and then by day 2, I'm so sorry guys, at about day 2 it's going to level off. Okay, so after 2 days, it's typically we don't expect to see much of an increase in serum CKMB levels. And then for troponin, troponin is going to have a similar curve. It's going to have relatively the same slope, but this time the peak's around 2 days, and then it'll drop off around 3 days. Okay, so it'll look something kind of like that. Your LDH levels are actually going to continue to increase, and they're actually going to peak at 2 to 3 days before kind of dropping down later. And then for your myoglobin markers, this final marker is actually really fast. It peaks about 12 hours, and it'll decrease at about after a day. So if you suspected that you had a heart attack really early, certain myoglobin markers may be helpful in helping you determine that, in conjunction with your CKMB and your troponin levels. But as you can see, there are many different tests, and they can test to see for how long ago you had that heart attack, if you feel like you did have one, all right? Or if we suspect that you did have one. Moving on to the liver, if you have functional problem with your liver, which means that your liver is working. In this case, it's not going to be working, and these are going to be the result. You're going to have increased ammonium, increased bilirubin, and decreased albumin levels in your serum. Okay, and then for here, it's going to be the integrity test. These are going to be the tests to see whether or not your liver is actually working. So you're going to have two enzymes here. It's going to be aspartate aminotransferase, AST, or alanine aminotransferase, ALT. The last one here is called alpha fetoprotein, or AFP. This is only expressed when you're a kid, when you're very young. In adults, instead of alpha fetoprotein, you're actually producing albumin. Okay, so so if you're an adult and you have you think you have a liver injury problem, and they do a screening and they find AFP in your blood, it's very likely that you have cancer, because this is not normally found, okay, in adults. So now if we look at the different alanine aminotransferase versus aspartate aminotransferase levels, if we have a higher amount of alanine aminotransferase, then we're going to say that there's going to be liver damage, and it's probably due to a gallstone. Okay, if we have higher levels of aspartate aminotransferase, we're going to safely assume that this is probably due to ethanol poisoning. And you might also find ALP and GGT. These are what we're going to talk about right here. Okay, so bile ducts, the bile duct is actually very closely correlated with both your pancreas and your liver. Okay, so if you have bile duct obstruction, it can lead to certain problems such as liver damage or pancreas damage. Okay, so the two things that we're going to look at here are alkaline phosphatase, ALP for short, and gamma glutamotransferase, which is GGT. Okay, now we got to keep in mind that alkaline phosphatase is actually found naturally when you're growing bones, for example. You're going to naturally have increased levels of ALP. But if we have both ALP and GGT out in the bloodstream, that's going to help us diagnose that whether or not we have say a gallstone or some other bile duct problem that may exacerbate these symptoms. Okay. Now, if we have abnormal amounts of ALP, just very high concentrations, that might be because of bone cancer and stuff like that. So that's why you need the presence of GGT to come to a diagnosis of is this a bile duct obstruction, or is it exacerbating these liver injuries or pancreas injuries. All right. So now we're going to look at pancreas injury, and the first thing you need to keep in mind is that alcohol and gallstones contribute to about 80% of these cases. So a vast majority of pancreas injury cases are due to alcohol abuse or gallstone formation. So if we look at acute pancreatitis right here, your pancreas is going to have alpha amylase and pancreatic lipase. Okay, so if these are going to be in your serum, then that's going to be indicative of pancreas injury. So keep in mind that amylase and lipase are related to your pancreas. All right, and so if we're looking here, if you have a higher lipase to amylase ratio, that's typically due to ethanol poisoning. And the way I think about it is you need lipase to help with alcohol degradation, to detoxify, right? So if you have a much higher lipase level, then it's probably due to ethanol poisoning. And if you have an increase of amylase and lipase, which keep in mind is from your pancreas, in combination with ALP and GGT, which was from your bile duct, so if you have the presence of all four, it's probably due to a gallstone. And the reason for that is because if you have that bile duct obstruction, you could lead to that pancreas injury, right? And having both of these markers here leads you to safely assume that it's probably due to a gallstone, and we need to ultrasound for that or use another method to test. Okay. And then for chronic pancreatitis, this is from things such as cystic fibrosis or pancreas injury due to excessive drinking and cirrhosis of your liver. Okay, and this is going to lead to less of your enzymes being formed, your alpha amylase and your pancreatic lipase in your serum, as well as having that sticky duct from your bile duct. And that's due to, for example, in CF, remember that you have less CFTR channels, and that as a result is going to keep your chloride ions inside of the cell, and as a result you're going to keep your water and your salt inside of your cell as well, and that prevents excretion, and as a result you're going to have mucus that is very sticky, very dry. All right, so I hope that this video has been helpful. I'm going to summarize really quick. So if you have an MI, it's probably the markers you should probably test for are going to be your CKMB or your CK2 if it's within about 2 days. Okay, you're also going to test for troponin levels. It's typically going to be used in conjunction with that CKMB test, and typically you can see that increase in troponin for roughly 4 days or so, that very high level of troponin in your system. You can also test for LDH, lactate dehydrogenase. That typically also does have, after 2 days, it's typically the enzyme that you want to test for instead of that CK2. All right, and then you kind of also have that myoglobin, which is very soon after onset of a myocardial infarction. And then for your liver, just keep in mind the two enzymes. So for your liver, you're going to have AST and ALT, okay? And then for your bile duct, just remember that your bile duct is probably due to a gallstone, and any of those blockages can be explained by ALP and GGT. And then for your pancreas, it's going to be that amylase as well as that lipase, okay? So the way I try to remember the liver is that it has both of them starting with A, and they're both acronyms. And then for pancreas, it's going to be amylase and lipase. Okay, so I hope that this video has been helpful. Hope that you took away something from this, and stay healthy, stay happy, and I'll see you next time.